So I'm just going to hand over Deirdre Jones. Her preferred name is Dee. She's 30 with a gravida 3, parity 2. Previous pregnancies were normal vaginal births. She's AB positive blood group. GBS is unknown. She didn't have the test. Her iron, B12 and vitamin D is deficient and low. She's gone into spontaneous labour, ruptured membranes without intervention, pink liquor with minimal drainage, and she would like to use the bath. Her partner's name is Ralph. Okay? Yes. Thank you.
Hi Dee, my name's Taylor. I'm just your midwife today. How are you going?
Hi Taylor. Yeah, I'm okay. This is my partner Ralph.
Hi, I'm Ralph.
Nice to meet you, Ralph. So it's just our understanding that your contractions have become more frequent and that you've been eating and drinking in small amounts. Is there anything else we need to know?
Her membranes ruptured before we came in here.
Okay, and what colour were they?
It was pink.
Okay, no worries. Okay, I'm just going to go through your VMR and birth plan with you to make sure your stay is more comfortable. Is that okay?
Yeah, that's fine.
No worries. So I understand you wanted a home birth originally, so we'll try and make you as comfortable as possible. We also understand that you'd like a warm bath to labour in, is that right?
Yeah, that's right. I wanted a home birth originally, but I changed my mind because my doctor told me about the risks about my iron deficiency, so I thought it'd be best to keep myself and the baby safe and come into hospital.
Yeah.
Okay.
Just in case she required a transfusion, so yeah,
Yeah,
we
no
keep
worries.
her safe.
Alright Dee, so just a reminder that because you're an iron deficient, we are going to need to check your bloods after the birth, and if your hemoglobin is low, then you will be offered a blood transfusion after the birth of the baby, or in a postpartum period. As your GPS status is unknown, however, we have also attached a bung IV in case antibiotics are required. Is that alright?
Yeah, that's fine.
Alright Dee, so we're just going to do a couple of assessments if that's okay. So that's going to include feeling your tummy a little bit, doing your vital signs, a vaginal assessment to try and see how dilated you are.
Yeah, sounds good.
Cool. Okay, so your baby's in a good position and your vitals all look fine. You're 5 centimeters dilated at the moment, which is all good. And yeah, we're gonna have a baby soon. Hi Dee, how are your contractions going?
They're actually getting really painful. They feel really strong at the moment.
Okay, no worries. There's some things we can do to help with that. We'll probably start off with you trying some different positions if you'd like.
Yeah, that sounds good.
No worries. Okay, Dee, so the first thing I'm going to get you to do is to just go on your hands and knees, creating an all fours position.
What can I do to help?
You can massage her back if you like and just support her. Yeah. Then Dee, I just want you to sort of move your pelvis side to side while breathing slowly in and out. And how does that feel?
Yeah, it's okay. I'm still a little bit uncomfortable.
That's alright, we can try something else. I want you to sort of lean more on your elbows and then spread your knees a bit wider apart and sink closer to the ground.
Should I just do the same thing?
Yeah, definitely.
Cool.
Alright, Ralph, how about we get you more involved?
Yeah, that sounds great.
Yeah, no worries. So I just want you to put your arms around her and Dee,
Yeah.
you can embrace Ralph back.
Yeah.
And we'll just sway together, you know, just help her through her contractions a little bit.
Mm-hmm.
Yeah, rub her back, that's nice. Alright, Dee, how does that feel?
I think I want to sit down.
Okay, well, see that birth ball just behind you?
Yeah.
We're going to have a seat on that. And I just want you to sway your hips slowly side to side and rotate them if they feel a bit better that way. Yeah, Ralph, just keep up the massage on the back.
Ralph, can you not touch me right now?
Yeah,
I feel
sure.
uncomfortable.
Yeah, no worries.
I think I want to try the bath now.
No worries, we've had that running for a little while now. It should be ready by now. Hey Dee, how's the water? Is it warm enough?
Yeah, it feels really nice.
Yeah?
Yeah.
Is there anything else we can do to help?
Ralph, can you get in the bath with me, please?
Yeah, no worries.
Just massage me.
How's it going now, Dee?
Yeah, this feels good. I think I want to stay in here a bit longer.
Alright, no worries. If you just get the urge to push or you feel like, you know, the baby's coming, Just press the call button, otherwise I'll come back in here and check on you, and then we can decide whether you want to birth in the water or if we want to get you out again and on the bed.
Okay, great.
Whatever you like and think is best.
Awesome.
Thank you.
See you soon.
Pain varies depending on the woman. Pain is sensed when damage is registered by nociceptors in your body. Each receptor forms one end of a nerve cell. The nerve cell connects to the spinal cord through a long nerve fiber or axon. Once nociceptors are activated, it sends an electrical message up these fibers. The nerve fiber is intertwined with many others from the peripheral nervous system, to which the signal passes up the neuron within the peripheral nerves to reach the spinal cord. The electrical signal enters the spinal cord through the dorsal root ganglia, which then transmits the signal up the spinal cord to the brain across synapses. Once the signal reaches the brain, it is transmitted to the thalamus, which relays signals to different parts of the brain. These signals are sent to the somatosensory cortex, the frontal cortex, and the limbic system, resulting in a response. Pain relief in labor can either be pharmacological or non-pharmacological. The non-pharmacological pain reliefs and coping mechanisms in labor include massage, TENS machine, acupuncture, position changing, and immersion in water. Massage. This can stimulate the body to release endorphins, which are mood-lifting substances and act as pain relievers. This has also been shown to ease pain and reduce anxiety in the first stage of labor. It can help women handle contractions by making them feel less intense and more manageable. TENS. TENS stands for Transcutaneous Electrical Nerve Stimulation. It is a machine that gives out little pulses of electrical energy, preventing pain signals from reaching the brain, or it stimulates the body to release endorphins. The TENS machine has 4 wires coming out of it that are connected to sticky pads. These pads are placed on the back and transmit the electrical pulse from the machine to the person. TENS may help the woman to feel like she has control over her contractions and may also provide a distraction for her. It may also make her feel less anxious. Acupuncture is a practice in which trained practitioners stimulate specific points on the body by inserting thin needles into the skin. These points are located in places where nerves, muscles, and connective tissue can be stimulated. This causes an increase in blood flow and also activates pain relievers such as endorphins. In cases of labor, this can help with back pain. Position changing. Upright positions help make contractions efficient and can sometimes make the woman feel in control. It is important to keep the woman comfy with pillows and cushions when doing these positions. Immersion in water helps by diminishing the stress hormones and reduces pain by increasing the body's production of endorphins, which are pain relievers. Lying down in labor may cause it can increase muscular tension and help women relax. Longer labor, a higher chance of cesarean section. When doing this, water must stay at the same temperature. The baby going to special care. A narrow passage for the baby going through the pelvis. Epidurals, opioids, pudendal nerve block, perineal infiltration, water injection.